Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 268 of the Ask Dr. Angela podcast. So last night, my wife and I had both the pleasure and the privilege of seeing Madagascar at our minis, i.e. Francesca's school. It was a production put on by the lower school, and even though Francesca had already seen this production, we were like, why do we have to go back and see this? It's Friday evening, we'd much rather be going out to dinner, having a few drinks after a long week. And so Francesca says to us, Mama, I know that I've already seen this in school, but the lighting is so much better at night. Now, how do you argue with that? Anyway, she was actually really correct. We went, we had a great time. The lower school did an amazing job. And I love to see the older kids put on these productions because the younger children really enjoy it so much. And I got to tell you again, we really had a good time. So today's question comes to us from one of our male listeners. His name is Chris, and this is what he says. Dr. Angela, last month my wife got pregnant but had a miscarriage. She had an infected fallopian tube that the doctor said led to her suffering the miscarriage. My wife just had surgery. We have a few questions for you. First question, will having one fallopian tube affect her getting pregnant naturally? Second question, how long is the normal recovery time for that type of surgery? Third question, I know IVF is an option. How long should we wait before looking at the IVF option? Those are all really good questions. And I got to tell you, Chris, I really appreciate the fact that you reached out. You see, it's not just the ladies that follow Dr. Angela. So let's get right in and answer your questions. Will having just one fallopian tube affect her getting pregnant naturally? Honestly, not really. And I say not really if a couple of things hold true. Number one, your wife is healthy. Number two, your wife is having regular monthly ovulatory cycles. Number three, the remaining fallopian tube is healthy. So some of you might be wondering, what the heck are fallopian tubes? In a nutshell, fallopian tubes are tubes that attach to the uterus. They have what's called fimbria on the end. And basically, it's like the ovaries playing baseball with the fallopian tubes. The ovary releases the egg, the fallopian tubes with the fimbria at the end. The fimbria catch the egg, and then the egg travels down the fallopian tube. And if you're lucky, your dude shoots out some sperm, and hopefully the sperm travels to the tube, fertilizes the egg, and then that fertilized egg makes its way and implants into the uterus. That may be overly simplified, but that's kind of the gist of what happens. So as long as you have one functioning ovary and you're having regular cycles, you should be good to go. Not everyone has two fallopian tubes. As in this instance, some people have a fallopian tube that's removed, whether it be because of infection, maybe tumor, etc. So you could be missing a tube due to surgery. The other interesting thing is sometimes, folks can be born without fallopian tubes. And then certainly sometimes there are things such as ectopic pregnancies where fallopian tubes have to be removed as well. So again, if you've got one ovary that's good, you've got another fallopian tube that's healthy, your shot is still pretty good at having what you deem, air quote, a natural, end air quote, pregnancy. Okay, so second question, how long is the normal recovery time for the type of surgery that your wife had? I'm not really sure because I'm not sure what kind of surgery your wife had. I'm not sure if this was a minimally invasive surgery, i.e., I do happen to be a minimally invasive surgeon. I do a lot of robotic surgery as well as a lot of laparoscopic surgery. If this was a laparoscopic surgery, i.e. minimally invasive, and we were able to do this through very small ports, your wife is probably looking at like a 2-week recovery. However, if this involves something like a mini laparotomy where we have to actually make an incision a little bit larger, in the bikini line, so to speak, then your wife is probably looking at like maybe a 4 to 6 week recovery. But again, it depends on whether this was an open or a closed case. And then I think your last question, referring to IVF and whether or not that was an option and when it should be an option, my typical rule of thumb is this. If you've been trying for at least a year and you've unsuccessfully, and you've been unsuccessful at getting pregnant, you should probably get some help. If you are 35 and older and you've been trying for 6 months and you still haven't gotten anywhere, i.e. a pregnancy, then I would recommend that you see someone, i.e. an REI. So a little bit sooner for my ladies that are 35 and older, only because time's a ticking, okay? So Chris, thank you so much for reaching out. That was a really good question, or should I say series of questions. And I'm just happy that you reached out. I'm sure this podcast will answer a lot of questions that some folks had and perhaps just were afraid to reach out. So thanks for, submitting. So in closing, I would like to thank all of you for tuning in. I appreciate all the love. If you happen to have a topic or a question that you would like addressed on the podcast, you know how to reach me, www.askdrangela.com. That's AskDrangela.com. You can hit me up on any of my social media avenues. That's going to be Twitter, Instagram, and Facebook. In closing, I want to leave you with this quote from one of my favorite books. That's Life's Little Instruction Book. And instruction number 183 says, let people know what you stand for and what you won't stand for. I always tell people, you teach people how to treat you. Reflect on that. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 269.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.